Hello, good afternoon, everybody. First of all, I'd like to welcome all of you to this afternoon's talk on hepatitis. The title of my talk is Hepatitis Can't Wait, but There is Hope After Hepatitis. Well, today is the World Hepatitis Day, right? And it falls every year we are celebrating this World Hepatitis Day on the 28th of July, okay? And you know the reason why we celebrate Hepatitis Day on this 28th of July because 28th of July is the birthday of Dr. Bloomberg, who is the discoverer of hepatitis B, way back in 1961. So today we're going to talk about the various types of hepatitis. All right, I will be emphasizing on hepatitis A, B, and C because these are the commonest type of hepatitis occurring in Malaysia. Right. First of all, we look at the liver, right? Because the liver is actually the largest organ in the body, right? Where is it situated? It is situated just below the right rib of the rib cage, and you can see that the liver has got how big is the liver? It's about the size of a football in adult, and also in children, it's about the size of a grapefruit. Okay, and then there are many functions. Liver is a very important organ, as you know. It has many functions, but the four main functions involves your purification, okay, of the all the blood products and that goes through the liver. It has to be purified, and then synthesis means it involves in the synthesis of many vitamins, for example, right? Vitamins B, C, and all that, and also the storage of a lot of important nutrients in the body, like albumin and all that. Okay, and also transformation of drugs that have to go to the liver to be detoxified. So it has many functions. First of all, what do you mean by hepatitis? The word hepa means liver in Greek, okay, and in Latin, sorry, and the word itis means inflammation. So when you have hepatitis, it means inflammation of the liver. Right, you can see there are altogether 5 types of hepatitis, alphabet A, B, C, D, and E, right? You can see that this slide shows you the various types of the hepatitis, how they are spread, the route of transmissions differ from one to another, and also the ways we can prevent this various type of hepatitis. For example, we go to hepatitis A first. Hepatitis A is a virus, it's actually RNA virus, okay, found in the stool of a person with hepatitis A. How it is spread? It is spread what we call by the fecal oral route. That means contaminated food or water, okay? And this, for example, if the patient has hepatitis A, okay, the virus will be found in the stools. So after going to the toilet, for example, his hand is contaminated with the virus, but didn't wash his hand properly. So he and she contaminated this food by touching the food, and then somebody else takes the food, and that person becomes infected with the hepatitis A virus. That's what we call fecal oral route. Okay. Now, what is the incubation period? Incubation period means from the time the exposure to the virus and the time that you develop symptoms is called the incubation period is about 4 weeks. Okay, so how is hepatitis A spread? Okay, usually it's from one person to another. Okay, and it is commonly spread by eating food that is contaminated with hepatitis A virus. For example, if you eat food which not, for example, eating raw shellfish. Okay, which is not well cooked. Okay, the virus is still alive in the shellfish, and so if you have the shellfish which is contaminated with this virus, by eating this, you can actually transmit this infection. And that's how, when you actually have a lot of this ham, this shellfish, so it tastes nice actually when you have char kway teow with this ham. You don't want to have this the ham that is too well cooked. It doesn't taste nice. So what happens is that if it's not well cooked, okay, the virus can still survive, and you can actually get infected with this virus by eating this not well cooked shellfish, right? Okay. Also, it can be transmitted by drinking contaminated water, okay, or even swallowing contaminated ice. I think we had an outbreak in Penang many years ago. I remember, when there's a short outbreak in Penang because of this contaminated ice or hepatitis A. All right, so I read in 2012 there was an outbreak of hepatitis A by drinking contaminated toddy, and this happened in Manjung in Perak when I grew up. Okay, so anyway, so hepatitis A, you can see, is transmitted mainly to fecal oral route, and some of this food that can be a source of infections are the shellfish, so forth, right? I can see here the photograph. Okay, so what are the symptoms of hepatitis A? Okay, all these various symptoms of hepatitis, they occur in all the different types of hepatitis A, for example, A, B, and C. Okay, it does not. The symptoms are, if acute hepatitis, they are very similar. Okay, so it doesn't mean that one sort of symptom is very special to a specific type of hepatitis. While if you got acute hepatitis A or acute hepatitis B, you have very similar symptoms, right? And the symptoms are, first of all, they lose appetite, and fever. Sometimes you can feel very tired for no reason, and then you may have a bit of diarrhea, vomiting, okay. And you will notice that the eyes becomes a bit yellowish, and the urine becomes dark, because dark urine, okay, and the stools become very light. So when you have yellow eyes, when your eyes become a bit yellow, it's called jaundice, all right. And for those cigarette smokers, you can see that they go off the cigarettes. They have loss of taste for cigarettes. So for those wives, you notice your husband suddenly a smoker has lost the taste for cigarettes, so maybe you should suspect maybe you got hepatitis A. So these are the symptoms of hepatitis A. You can see this girl actually had acute hepatitis A, and she was jaundice. This Indonesian girl many years ago, okay, was admitted here, and she nearly died because she got a severe hepatitis A. So hepatitis A in adults can be very serious, and usually in adults they have symptoms. Whereas if you have hepatitis A in children, you tend not to have symptoms. You may be asymptomatic. Okay, but if you have symptoms, these are few of the symptoms. And hepatitis A, the good thing about hepatitis A is that if you recover, you recover fully. Okay, it's called acute. You don't becomes a chronic carrier of hepatitis A. So hepatitis, good news is that when you recover fully. All right. Okay, and usually most patients will recover from this attack of acute hepatitis A, and they will have antibodies. Right. Okay, but but now we have vaccines. So how to prevent hepatitis A? First of all, we have this vaccine. Okay, and this vaccine very similar to the Sinovac vaccine of COVID vaccine that we have now. Okay, it is inactivated vaccine. Okay, inactivated virus A, and then usually given in 2 doses, and the protection will last for at least 20 years. Okay, it's very safe, and there are other ways besides the vaccine we can prevent hepatitis. I think a lot of it is through washing of hands. Okay, after especially going to the toilet. So personal hygiene is very important, right? Wearing of gloves and all that. Okay, and So when you drink water, so you make sure that the water is boiled, and then also if you be careful when you actually take uncooked shellfish. I think once I had food poisoning as well when I took the oyster. Okay, a live oyster. You like oyster, which is not fully cooked. So these are potential sources where the virus, hepatitis A virus, can actually live. Right. So other ways of protection and personal hygiene, and then that's the reason why nowadays the hepatitis A is not common. It's usually occur in outbreaks, and so we come to next to the hepatitis B virus, right? This hepatitis B virus is different from A in a sense that it is a DNA virus, unlike the hepatitis A, which is a RNA virus. Okay, you can see here that this DNA is in the core of the virus, and it is spread differently from A. In that it is spread through either blood contact, or it is present in body fluids and also in blood. Okay, and also in semen, and so it can be, a person can be infected. The most common way of infection in our part of the world is from the mother to the child. Okay, at the time of birth. All right, that is more than 90% of cases. So when the mother has got hepatitis B, it is transmitted to the baby when the baby is born. But because of vaccination now, this route of infection is not common because of vaccination. Now, how common is hepatitis B, right? We know that about 2 million people in the world is infected, a lot, okay? And about 292 million worldwide are chronic carriers, okay? More than 2 million deaths a year directly related to hepatitis B. And you know that hepatitis B is actually 100 times more infectious than the HIV virus, okay? And unfortunately, this virus is predominantly occurred in Asia. 75% occur in Asia, and in Malaysia, about 5% of the populations are actually infected with hepatitis B. So in the Asia Pacific region, okay, you can see that these are number of carriers. For example, in China, 120, followed by India, Indonesia, and you look down Malaysia, about one. There are roughly about 1 million carriers now, hepatitis B carriers in the country. Okay, so there are various ways of how this virus is being spread. Okay, in this part of the world, in Asia Pacific region, the commonest route, as I said, is from the newborn, from the mother to a newborn. Okay, and it can be spread sexually. Okay. And also transfusion, but the blood transfusion now is rare because we routinely screen patients for hepatitis B, HIV, and also hepatitis C. So this route of transmission is not common, all right? But before that, it can be actually transmitted by blood transfusion. In fact, the commonest route of transmission now in Malaysia is through sharing of IV drugs. So in the drug addicts, where they share the needles. Okay, so this is how hepatitis B and C is spread. Okay, you can also get hepatitis B through hemodialysis as well. Okay, and through needle stick injuries. Okay, so tattooing is one way, but then make sure that the needles that you use for tattooing is disposable one, right? So it can be spread. Hepatitis B and C can be spread even through tattooing. Okay, contaminated needles. Okay, now hepatitis B, can be a serious disease, especially if you have chronic hepatitis B. So for A, we know that you can't get the hepatitis A virus, the infection will not become chronic. But for hepatitis B, because it is transmitted from the mother to the baby, once you have this, you tend to be a carrier because the virus remains in your blood, okay, unless you get treatment. And over a long period of time, it can, especially if the virus is active, it can cause problems, right? It can cause chronic a liver disease called chronic hepatitis, then this can lead on to hardening of the liver called cirrhosis, and finally to liver cancer. In fact, hepatitis B accounts for about 80% of the liver cancer in Asian countries. Okay, and patients with hepatitis B have a 40% risk of getting cirrhosis or hardening of the liver, and they have a greater risk of developing liver cancer compared to normal population. In fact, the risk is about 200 to 300-fold greater for getting liver cancer if you are carriers of hepatitis B compared to the general population. So first of all, how do you know you got hepatitis B? You can be asymptomatic. In fact, most of the patients with hepatitis B do not know that they have got the virus because they don't have symptoms. And the only way to know you have got the hepatitis B is doing a blood test. Very simple. You do a blood test, then you look for what does the result show. Okay, it's either show that you got the hepatitis B virus. Okay, it's called HBs antigen positive, or you don't. If you don't have the virus, then the next thing you want to know is whether you got antibodies or not. So if you don't have the virus, usually you have antibodies, okay, if you have the infection before, right? Or if you have been vaccinated before. So once you have the antibody, then you're protected. So important to know whether you have a hepatitis B and then whether you have antibodies or not. If you don't have antibodies, you get vaccinated, right? And that is how we can prevent hepatitis B. Okay. So many of us, many patients with hepatitis B do not know that they have hepatitis because the symptoms, first of all, they may not have symptoms, and if they do have, it can be very mild. Okay, for example, they just feel tired for that reason. Usually, the obvious, they can get sometimes jaundice in acute, like just like hepatitis A. Okay, but this is seldom the case. Okay, usually patients, by the time they notice they have symptoms with hepatitis B, is when they already developed complications. And what are complications? Okay, the complications are they can get very bad cirrhosis with jaundice, yellow eyes. Then they have past dark urine. They feel very tired. They have swelling in the abdomen. Okay, and they have so like this, they can have yellow eyes because of the jaundice, just like this patient. And you notice that because they have very low albumin in the blood, so the nails become white, and we call it finger clubbing. When you look at your nails, you see that there's called clubbing of the nails. This is one of the signs of liver disease, chronic liver disease, and then they can have breast enlargement, and also they have this what we call spider nevi, so blood vessel like a spider with the shape. This is present in very often on the chest of the patient. Okay, and if you look at your palms, you can see that they have red palms. So you can look, some of them have got red palms. It may be due to liver problems. So or sometimes it can be due to alcohol as well, right? So this is a patient, male patient. So you can see that the breast is enlarged. Okay, and this is one of the signs of liver hardening, right? Big tummy here, you can see this patient had in fact had liver cirrhosis. They had liver cancer. You can see here the operation, the scar, previous operation for the liver cancer. Okay, liver cirrhosis, they can get hardening of the liver. You can see here, these are the signs of on the X-rays, on the MRI. Okay. Here you can see a normal liver. You can see the edge of the normal liver here, very smooth, right? Okay. And this on this side here, you can see that this is a hardened liver. You can see that the edges of the liver is jagged. Okay, it's a shrunken liver, and there's some fluid here. So this is MRI showing the hardened liver. Okay, and hepatitis B, there are long-term complications. Patients can develop liver cancer, leading to death. Okay, from the time of the infection to this liver cancer can take up to 30 to 50 years. Right. So there are ways how can we diagnose hepatitis B, right? So if you have liver cirrhosis, we can use what we call ultrasound to look at your liver, okay, or even CT scan, which can pick out very, very early cancer of the liver. All right. But however, if sometimes the hardening of the liver is very mild in early stage, you may not see that on ultrasound. Okay. This is just on the previous slide I showed you. Okay. Nowadays, we can diagnose very early hardening, or we call it fibrosis, scarring of the liver, by using this new machine called FibroScan. Okay. You can see that this is a very new tool. In the past, we need to do liver biopsy sometimes to confirm whether you have hardening of the liver caused liver cirrhosis. But nowadays, there is a machine, this technique called FibroScan. We can see, we can just put a probe here, okay, and then we can tell whether your liver is hardened or not. Okay. So, what is the treatment for hepatitis B? Well, for acute hepatitis B, if you recover from it, there's no need treatment, okay? But most of our patients with chronic hepatitis B, okay, it all depends on whether the virus, whether you are just a carrier, whether carrier means that your virus is inactive or like sleeping, is dormant in your blood, okay? But when the virus is active in the blood, the hepatitis B virus can actually, in the long term, causes hardening of the liver, and if it's active, you will need to have antiviral treatment. And there are now a lot of medications. For example, the two medications that can really help to suppress the liver, the virus, is the entecavir, which is called Baraclude. I think some of you may have heard of this drug. And the other one, the new drug, is called tenofovir. Okay, these two drugs are the drugs of choice now, where you can take to suppress the liver. So there is treatment. Okay, but still the treatment usually need to be long lasting, for at least 1 year. Okay, because it is quite difficult to actually cure the hepatitis B, get rid of the hepatitis B virus completely, but you can suppress it now with the antiviral drugs. Okay, so there is treatment. Then you should, that's why you should be follow up and see your doctor, because there is treatment for hepatitis B. All right. Those cases where the liver has already failed or had very bad liver cirrhosis, you may need a liver transplant. Okay. Hepatitis B virus can be prevented. Okay. Just like the COVID-19 virus now. So there are vaccines. This vaccine, okay, was discovered also by this Dr. Bloomberg. 1 year after he discovered the virus, he developed the vaccine. Okay, now we have this recombinant vaccine. Okay, it is DNA engineered DNA virus vaccine, X antigen vaccine, and it's given in 3 doses, very safe. Okay, and 0, 1, and 6 months apart. And it's very effective, over 90%. Okay, or it can be prevented now. Okay, so this vaccine can be given together with hepatitis A vaccine. So now we can actually combine the 2 vaccines together. It's called twin rigs. You can, so instead of giving you 2 injections on 2 arms, but by the way, the vaccine must be given in the arm, not in the buttock, right? Okay. So it can be combined. They call twin rigs. A and B can be combined together, and it can be given. Nowadays, it is usually given to mothers. Okay, to babies born with hepatitis B. Is very, nowadays the vaccination B has been introduced in Malaysia since 1989, right? And because of this compulsory vaccination of hepatitis B, the rate has really decreased tremendously. Okay, and we have already achieved WHO aim of for hepatitis B in Malaysia. So every child should be vaccinated at the time of birth, okay, with the hepatitis B vaccine, and that is how we can prevent hepatitis B. Now, the other thing, how can we actually help to if you got hepatitis B, okay, what can we do to improve? Oh, a lot of patients comes to me and say, hey, doctor, we know we cannot drink alcohol, right? Okay, but what else can we do? Well, the good news is that this is one thing you shouldn't do, okay? Don't drink alcohol. But coffee, drink coffee. Coffee has been shown to help your liver. I will show you all the evidence now, right? You can see here, nowadays, uh, the companies even name all different types of alcohol, but the brands to attract people, you know. For example, now we have the brand called Teachers, okay, named after the four pillars of society. Those advocates means the lawyer, okay. There's another alcohol name for doctors, doctor special, okay. And this one is engineer, correct. You can see, you know, so there are various so next time if you were to drink, I would say please stop drinking alcohol, but drink coffee, because coffee has been shown to help your liver. Coffee has been shown to help patients with hepatitis B and C, patients with liver cancer, okay, fibrosis with hardening of liver, and even fatty liver, okay. This is one of the latest trials that been published, okay, and be presented not long ago in the American Liver Meeting when they did this is a study done in Australia where they evaluate 1,130 people, okay, who drink coffee, okay, and 47% of them are hepatitis B, 38% have hepatitis C, and then 15% have fatty liver, okay. Most of us actually have a bit of fatty liver. So they analyze these people, okay, and this is the method. These people have been drinking. They interview the patient, all right. Um, these people have been drinking in various type of coffee, including instant, espresso, filtered or boiled coffee, okay. During this 1 year of analysis, they checked the patient's blood for liver enzymes and the BMI and smoking habit, alcohol consumption. And then they did what they call fibroscan. Just as I showed you earlier, this is to assess the hardening of the liver, the fibrosis, and also to see how much fat they have in the liver, okay. So after this is the results of patients who drink coffee, okay. I show you, very interesting. Those with hepatitis B who drank 4 or more cups of coffee every day, they actually have significant reduction in their scarring, less by 18% compared to those they don't drink coffee at all, right? And those with hepatitis C who drink more than 2 cups of coffee a day have their reduction of liver fibrosis or hardening, scarring of the liver, okay? So it helps in hepatitis C as well. And those with fatty liver also, if they drink more than 4 cups of coffee per day, they actually find that the hardening, the liver scarring improve by 24%. So the conclusion from this study is that the coffee consumption actually is associated with less liver scarring, okay, in patients who have hepatitis B, C, and even fatty liver. They found also that they have less fat in their liver, okay, and that's why when you drink coffee a day, 1 to 3 cups of coffee, it will help. And the reasons why coffee helps in the liver disease is these chemicals called carval and caffeine. It is present in the caffeine, okay. The caffeine produce what they call paraxanthins, okay, that slow down the growth of the scar tissue involved in the fibrosis of liver. This is how we speculate that coffee actually. So if you do drink coffee, I would advise you to actually just drink the black coffee, okay, or you can use it with a creamer, but don't put sugar, all right? So black coffee is the best. Okay, now finally we come to the last virus, which is the hepatitis C virus, okay? This is also a RNA virus, okay, and it's present in the body and body fluids, okay? And the incubation period is about 7 to 9 weeks. How common is it? Well, it's about 170 million people worldwide are infected with this virus. 3% of the world's population are infected with hepatitis C virus, and about 3 to 4 million people infected every year. In Malaysia, it's been estimated that about 2 to 2.5% population have hepatitis C, right? And in terms of race, hepatitis B is commoner in Chinese, whereas hepatitis C is much commoner among the Malays, right? And hepatitis, this is a graph, this is a world map showing you the incidence of prevalence of hepatitis C. You can see in Malaysia here, which is shaded in orange, is about 5% to 10%, right? So in the prevalence of hepatitis C in this country is about 2%. Okay, so how can you get hepatitis C? Mainly, you can see here, even also in Malaysia, 90% of the cases actually due to sharing of needles in drug addicts, okay? To sharing of needles, okay? So this is the commonest way it's been spread. Of course, it can occur also through blood transfusion. That is before 1985. So if you have blood transfusion before 1985, you probably need to check your blood for hepatitis C, because you can still get hepatitis C. But nowadays, we are routinely screening blood for hepatitis B and C and HIV. So it's very unlikely that you get this hepatitis C through blood transfusion, okay? Also, you can get hepatitis C through hemodialysis as well. So who should be screened for hepatitis C? Okay, if you have your blood tests done routinely, okay, and during your medical checkup, you'll find that your liver function test shows a raised liver enzymes like ALT. It is important to check for hepatitis C, because this virus can potentially cause the liver enzymes to be raised, okay? And nowadays we have treatment for hepatitis C. So it's very important that we don't miss hepatitis C, because a lot of these patients with hepatitis C, they do not know they have this hepatitis C unless you go for a blood test, because usually you don't have symptoms, right? Or if you receive blood transfusions before 1992. Here, I think it's 1995, they start screening for hepatitis C, right? So those on hemodialysis and those children who have infected mothers with hepatitis C, they should also be checked for hepatitis C. And of course, in doctors and nurses who have needle stick injury, okay, where they be exposed to the hepatitis C patients, they are the ones that should be screened for hepatitis C, right? And also, if your partner has got hepatitis C virus, so you should test your blood also for hepatitis C. So what is the test? Now the screening test is called anti-hepatitis C antibody test. Usually it is a test we do routinely. But to confirm whether you got hepatitis C or not, you should do the HCV RNA using the PCR, just like the PCR test we do for COVID-19, right? So if you have positive HCV RNA, the virus in the blood, then you have got hepatitis C. Okay, hepatitis C is very similar to hepatitis B. It's spread through the blood contact, by blood contact. But it's a very slow-growing disease. Okay, it takes about maybe 20 to 30 years before you develop complications like hardening of the liver and also liver cancer. So hepatitis B and C can be serious if not treated. Okay, the good news is that there is treatment now for chronic hepatitis C, and the latest treatment is called direct acting antiviral. Okay, I have over the last few years Many of my patients have been treated successfully and cured with this new combination of drug called sofosbuvir and velpatasvir. Okay, now just by taking this tablet, one tablet a day for 12 weeks, you have a 95% cure rate. Okay, so now we got very effective treatment for hepatitis C. So that is why I say it is very important to check whether you got hepatitis C in by doing a blood test, because there is treatment now, there is cure. Okay, there is cure for hepatitis C already. So once it's cured, the virus will not come back, but you still need to be followed up by doctors. Okay, the last portion of my talk will be on liver cancer. Okay, liver cancer is the 12th most common cancer among males, more common in males than females in Malaysia. 80% is due to hepatitis B. Okay, and the rest is due to hepatitis C. Mainly among Chinese, okay, 44%, and predominantly among males, the ratio is about 5.3 to 1. Okay. As I mentioned, the risk factors hepatitis B, hepatitis C, alcohol, and those with a family history of cancer. Also, those who are taking nuts, especially those contaminated with the mold, there's a chemical called aflatoxins in the nuts, which can actually be a risk factor for liver cancer. This is a map showing you the liver cancer, the lower map showing you the rate of those high incidents occurring in this area. For example, those areas shaded in blue and also orange. A bit, you can see that Malaysia here, the rate is orange, about less than 6 per 100,000 population. Aflatoxins are present in the ground, in the nuts, right? Okay, so how to prevent liver cancer? You can prevent liver cancer by vaccination against hepatitis B. So if you can prevent hepatitis B, you can prevent liver cancer, right? And also, they have found, interestingly, that coffee drinking is associated with the reduction in the risk of liver cancer. Okay. So screening for liver cancer. How do you screen? Okay, they are usually do an ultrasound scan of the liver, and you can do a blood test called alpha fetoprotein. Okay. So we do this every 6 monthly, okay, in patients with hepatitis B and C to screen for liver cancer. It's very important, right? So those with this hepatitis B and C, and those with family history, okay, those who already have liver cirrhosis, because you can tend from whatever cause, for example, alcohol, or even from fatty liver, right? Once you have liver cirrhosis, you should also screen for liver cancer. This is liver cancer nowadays usually diagnosed very late because they don't have symptoms during early stage, where the liver is still, where the cancer is small, they don't cause any symptoms. But usually when the patient is diagnosed to have liver cancer, it's very late, because by the time they have pain or the liver, the cancer is very big, like in this patient here. Okay, you can show here on the MRI, it's a big cancer, right? All right, for this young patient, okay, who had, you can see here the marking, it's a very big liver here, okay, due to liver cancer. Okay, we should be aiming to detect cancer very early, because if you have a cancer like in this patient here, you can see that this patient actually was detected by his GP, because the GP did routine ultrasound because he was a hepatitis B carrier, okay? And they found that there's a small lesion here, okay? And we picked this up by the GP who sent to me many years ago. And we did the MRI, and they found that there is a very early cancer. And this patient, liver cancer, had the operation done, okay? You can see here the scar of operation, okay? And this cancer was removed, and he was cured, okay? So this is the scar of the liver surgery called Mercedes-Benz sign. I asked my surgeon why it's called the Mercedes sign, because they say that it's a very expensive operation. So they give them a Mercedes sign because the Mercedes car, is very expensive. So they give them a sign. Well, actually, this is the actual scar of patients going for liver surgery, all right? But nowadays, it is very advanced now. We can even do laparoscopic liver surgery. That means keyhole surgery like where you don't see these sort of scars, big scars like this, okay, for liver cancer. All right. Okay, I will show you a slide of this patient, all right, who is still coming back to see me. And this is one of my few patient, early patients who got hepatitis B, and she was cured of liver cancer because she was found to have early liver cancer. She had surgery done, and until today, you can still see the scar there. She's coming back every 6 months for me to check. She's cured of both hepatitis B. She also cured of liver cancer. So who says that liver hepatitis B cannot be cured? Yes, it can be cured. Okay, if we picked up early. Okay. Now, I will talk a little bit about vaccine because there have been a lot of questions been posted to me in an email about vaccines, and patients also just turned up recently to ask me whether they can get vaccines for the COVID to prevent COVID, when they have liver problem. Yes. In fact, they are safe to have the COVID-19 vaccines in patients with liver disease like cirrhosis or hepatitis. When you get a COVID-19 infection, okay, you will actually end up with a more severe disease because this virus also can attack the liver and cause hepatitis. So you will have a more serious disease. So in fact, it should be a priority for you to have the vaccine, the COVID-19 vaccine. So yes, and also, what about the medications you are on? If you are still on the antiviral for hepatitis B, you should continue then, okay? How is it effective, the COVID-19? Yes, the COVID-19 vaccine is still effective. And what about the side effects? Well, the side effects are still the same for patients with or without liver disease, all right? Okay? And the current three vaccines we all know is Pfizer, Sinovac, and AstraZeneca. Is it safe or not, right? I can give you the latest findings. There are a lot of fake news. You worry about fake news about all the various side effects of vaccines. That's why I'm showing you the latest result, which is published just in the New England Journal of Medicine on the 7th of July, just about 2 weeks ago, right? Now, New England Journal of Medicine is a very renowned, reputable journal. And all doctors will know that, right? If you talk to any doctor. If any article is published in the New England Journal, it is the truth, okay? It's the leading journal. And I think a lot of you are worried about Sinovac because there's been even there have been rumors about the side effects, whether it's effective or not, okay? I can tell you that these are the findings of the vaccine. It's just been published in patients in Chile, okay, when they have the vaccination for COVID-19. And they found that it is 65% effective in reducing the hospitalization, okay? Reduce the hospitalization by 87%, okay? We reduce ICU admission by 90%. And reduce, most important, is that reduce the death by 86%. All right. Although you can still get COVID-19 after vaccination, but you will get a less severe disease. And the most important thing is that it will reduce hospitalization and reduce the death rate. It is also effective against the variants. Now we know we have the Delta variant, okay? So variants of concern are the Delta, the current one is the Delta, and that's Delta variant. And even Sinovac and all these current vaccines, they are still effective against the variants, okay? So my take-home message is sum up as this. Number one, go for screening, even though you don't have symptoms, right? When you go for a routine medical checkup, screen for hepatitis B and C, okay? Because it can be treated now. Get vaccinated for COVID-19, all right? Go for vaccination. And you can actually have vaccination even for B and COVID-19 at the same time, no problem. Hepatitis C, they can be cured now, right? And hepatitis B can be controlled and even prevented. Okay, have your regular checkup for B and C, okay, so that you can screen, important to screen for liver cancer. And I will end by telling you that you drink 2 cups of coffee a day because it will keep hepatitis at bay. All right. So we end by cheers by maybe taking a cup of coffee, right? All of you, okay? Cheers. All right. There, we are now. Yeah, MCO. We will. This is cartoon sent to me by one of my friends about MCO, EMCO, CMCO, and RMCO. It's very confusing, isn't it? Okay. Now, MCO, what does it stand for? The MCO actually stands for making confusing orders. CMCO is continue to make confusing orders. And EMCO is even more confusing orders. Finally, you have RMCO, which is supposed to be recovery MCO. It means repeatedly making confusing orders. It shows that Malaysia really boleh. Okay. Now, there are names attached to certain cars, right? You all know. Okay. For example, Fiat. What does the Fiat means actually? FIAT. It means failure in Italian automotive technology. Fiat cars, right? Ford. You know, some of you drive Ford cars. It's good for only rough drivers. Okay. Hyundai. Hyundai means hope you understand nothing drivable and inexpensive. Actually, quite cheap, Hyundai cars. Volvo. Volvo is actually very odd looking vehicular object, but they are very safe actually. Volvo. Lots of Porsches. This is good. Proof of rich spoiled children having everything. That's quite true. Yes, I used to drive Porsche, but no more now. I go to Opel because I'm getting old already. Opel stands for old people enjoying life. Okay. Now, the one Toyota stands for the one you only trust. Toyota, right? That's true. Finally, have BMW. Big money waste. Actually, it's a waste. Okay. Okay. I used to have a BMW. Keep breaking down. Big money waste, right? Audi. Audi stands for an unwanted debt invitation. Yeah. Always have problems. I think it's about Audi. Now maybe it's better. Mercedes stands for what? Maximum enthusiasm, recurring cost, ego develop, eagerness to sell, right? This is called Mercedes. And finally, Proton, potential risk of tangkap, automatic, non-functional. So you know, breaks down quite often. So it's called Proton, right? Finally, okay, before we go to the questions, I will probably end this talk now. And you can actually, this is the Q&A session. I think we have some time, right? We can stand. I'm willing to answer any questions relating to hepatitis or vaccine, like COVID-19 vaccines now. Any questions you may have, all right? You may ask now. If not, I will go through some. Sorry. Oh, there's a question. Maybe read out. Okay, I can read it out from one of you. How many cups of coffee maximum can I drink a day? Oh, how many cups of coffee? It has been shown just now. I showed you. You can drink probably at least 1 cup of coffee to be effective, but you can drink up to 4 cups because it's been shown that by drinking 4 cups of coffee, you can actually improve with you have fatty liver, all right? Yeah. So more than that, I think it's not really necessary. Okay. And also, it depends on whether you have other illnesses. For example, if you have reflux disease called GERD, okay, where there's a lot of acid reflux, coffee actually sometimes can make it worse because it relaxes the sphincter, okay, of the muscles, of the junction between the esophagus and the stomach. So you will have more reflux. Okay? So it depends. If you don't have all this illness, okay, and you're well, you like coffee, yeah, you can drink up to 4 cups of coffee a day, no problem. The next question is what? Why HDU patient prone to get hepatitis? Hemodialysis patient, talk about hemodialysis patients prone to get hepatitis because you see the machine need to wash your kidneys, all right? So the hemodialysis machines, your blood has been exchanged. So if somebody go for hemodialysis, if they have hepatitis B or C in the blood, in the blood. So if the machine is not cleaned properly, okay, the next person using the same machine can potentially get the virus. Okay, so that's how the virus can be spread through hemodialysis. So it's very important that you should receive, the machine should be reserved specifically for patients with hepatitis B and C. Okay, and another machine separately for those patients who are not infected with hepatitis B and C. What is the difference between ultrasound, liver, and fibroscan? Yeah, very good question. What is the difference between ultrasound and the fibroscan? Ultrasound uses ultrasound wave to detect liver cancer, you can detect, okay, or any growth in the liver. It can also detect very obvious hardening of the liver, okay? And it is a tool you can use for detecting other things like gallbladder stones and all that. So it's an image, but you use the ultrasound wave, okay? And what you see is actually just black and white, okay? And it's also a non-invasive tool. Fibroscan is actually to detect early hardening, okay? When you can't detect it on the ultrasound, you use a liver, is to detect the liver stiffness, basically, for fibroscan, how stiff the liver is. And this stiffness of the liver is related to hardening, how hard the liver. So if you got very stiff liver, they use the ultrasound wave, the speed of it's called a shear wave, okay, of the ultrasound, speed of the shear wave from the ultrasound to travel to the liver and comes back, and you measure the speed of the wave, okay? So if you have a liver that is hardened already, okay, then the speed will be very fast. You get a very high reading because a hard liver transmits these ultrasound wave faster than a very normal soft liver, okay? So ultrasound can pick up very early hardening, which we can't pick up fibroscan, but we can't pick up on the ultrasound. And the other the important advantage of the fibroscan is it can actually quantify how much hardening you have, and also can quantify how much fat you have in your liver. For example, ultrasound can just show you when you do eyeballing and say roughly compared to the kidney, the liver appears more bright or white compared to the kidneys, which appears a bit black. So you can just say that the ultrasound, the person who performed the ultrasound can just say roughly that you have fatty liver, but cannot quantify how much fat in the liver, which the fibroscan can do that, right? So these are the few advantages of the fibroscan. Both are non-invasive, right? Fatty liver can take mRNA vaccine. Yes, of course. You got fatty liver, you can take the Pfizer vaccine, no problem. What up? Another question is, doctor, I have Whipple surgery due to severe pancreatitis. Okay. Can I take COVID vaccine? Yes, of course you can take COVID vaccine. Go ahead. You can take COVID vaccine. Okay. From this, another question. Hepatitis B in my body have tested finish, means I need more. I don't need to have a B jab, but I haven't done it for so many years. Oh, but meantime I have taking vitamin C. So is the vitamin C have effect or not? No, no. So the what you're worried about is that you got hepatitis B jab. You want to know, you want to check and see whether you are still protected or not. See, right? Okay, there is no need, once you got hepatitis B vaccination, okay, there is no need to check your antibody, because nowadays we don't believe in booster doses. That means giving you an extra booster dose if your antibody falls too low. Too low means less than 10, okay? So because we still have this cellular immunity. Even your antibodies falls less than 10, okay? But in certain situations, you need to check is patients, for example, on hemodialysis. It's very important to know that you have the hepatitis B antibody check every year, because if it falls less than 10, that means we will advise you to have a booster dose every year, okay? So in certain situation only, okay? Right. So what can a hepatitis B carrier do to protect his liver? Oh yeah, important thing is stop, don't drink alcohol, but drink coffee, okay? Drink coffee and don't to protect your liver. Yes, take healthy diet. Okay, don't take do a lot of exercise, take healthy food, and don't drink alcohol or don't smoke. Okay, and eat a healthy diet, and that's it really. And if you can, drink at least 2 cups of coffee a day. Yeah, what that? How about coffee enema? That's a very interesting question. Coffee enema. No, not really lah. I think nobody will. I mean, even some coffee, it won't work. Okay, coffee enema doesn't work. All right. What's that? The fibroscan costs roughly how much? Yeah, now the price has gone up. It costs about $800 now. Yeah, to do the test. About 800 ringgit. Yeah. What's that? Is it necessary for fatty liver people to do fibroscan to monitor the liver? Okay. If you ask the question, asked is that is it necessary for patients with fatty liver to do fibroscan? Okay, you can see that if you are at risk of getting hardening of your liver, okay, what group of patients? All of us, especially when you're a bit fat or obese, you tend to have fat in your liver. It's called fatty liver because the fat is deposited in the body and also in the internal organs, and liver is one of the internal organs where you have a lot of fat. Okay, now fibroscan is important to detect hardening of the liver and also quantify how much fat you have in the liver. So patients, what sort of patients tend to have hardening of liver? Patients who has got other risk factors like diabetes, very important, is number one, diabetes. Okay, number two, high blood pressure. Number three, high cholesterol. Number four, high uric acid. If you have an obesity, of course, if you are very fat. So if you have any of these risk factors, you should go for fibroscan because there is a likelihood, especially if you have diabetes, it is likely that you may have already have fibrosis already, okay, scarring of the liver, or even liver cirrhosis, early cirrhosis. So for this group of patients, it's important to do a fibroscan. All right. If the gamma GT show very high in the liver, is this related to hepatitis? Okay, gamma GT is very often raised in patients with alcohol, very sensitive to alcohol, or fatty liver, okay? And also, if you have alcoholic hepatitis, or if you have hepatitis, the gamma GT can also go up. But the main parameter in the liver function test is ALT. ALT is related to the damage caused by the hepatitis. So if you have inflammation due to the hepatitis, either A, B, or C virus, the ALT will go up, okay? The gamma GT is more related to the fatty liver and alcohol. Question: is that coffee enema helping in detoxification? No, not really. So I already answered the question, huh? Okay. That's all, is it? All right. Okay. Huh? Any more? I think that enough. Yeah. So, okay, you know. Okay. I think I've answered all the questions that has been posted to me. All right. If there are no further questions, I shall now close this session and wish to thank all of you for giving me this opportunity, for sacrificing your time to listen to me I know this Olympics is on now, so some of you maybe wants to like to watch the Olympics. But I hope that this program is useful to you, and I hope you have benefited from my talk. And I shall now end by having a cup of coffee. Okay, share with you a cup of coffee. All right. Cheers. Okay.